Good evening, Facebook and Facebook friends and future friends. My name is Claire. I am a physical therapist. I specialize working with people who have neurologic conditions, and I, with a few of my colleagues, founded the Neuro Collaborative, which is kind of a loose organization at this point in time with a goal of helping neurologic physical therapists, PTs who are interested in working with people with neurologic conditions or who do already specialize, to help them find positions that they love, have careers that they love, and really enjoy being a physical therapist working with this population. It can be extremely rewarding seeing the amount of potential that people have with things like neuroplasticity and how much their brain and nervous system can change, but it also can be a challenging population to work with because there are many barriers to people getting access to the best care, and there are a lot of things that we can help with as physical therapists, but sometimes that can lead to a little bit of burnout because there are so many people to help and there are so many ways that we can help them, it's hard to do it all. But we really love what we do and we want to help others love what they do as well. So Erin and I just had found a couple topics that have been coming up recently in our Facebook group. We have a private Facebook group called Neuro Collaborative Professionals, which I would encourage you to join. There's a lot of discussion in there about people doing all sorts of different things. And one of the things that have come up recently is different business models. And it's really cool because in the group, there are people doing all sorts of different business models. So figuring out how to make it work, no matter where you live, what you have access to, which population you work with. And we just wanted to talk a little bit about that topic tonight and share with you and then encourage you to come into the group because that's the best place to get more information. So I also think that I'm a pretty good person to speak about this because I have never had a regular full-time job. So I've been a physical therapist for 12 years now. I graduated in 2007. I did a neurologic physical therapy residency the first year. So that was 1 year of very unique experience of clinical work and teaching and learning and working on a research study and spending time with neurologists, which was wonderful. And then after that, I worked on a research study and split my time doing that and teaching. And then I started a program at an outpatient neurologic physical therapy practice for people with Parkinson's. And I've kind of bounced around doing a lot of different things, pretty much always being in the clinic in some capacity, often working on a research study that may have been half of my time during the week down to just a few hours. I've done a lot of teaching, both at University of Southern California up until a few years ago. And then I also do continuing education, teaching now through Parkinson Wellness Recovery. So I really have enjoyed having a pretty eclectic career and doing a number of different things. And I feel like working on research studies has really informed my clinical practice and has allowed me to understand the research better and implement it and maybe faster than is typical, since we know usually it's a 15 to 20 year time difference between when research is published and when new ideas are discovered and then when it's really implemented, especially on a regular basis in the clinic. So I feel like that has really sped up my learning and my ability to help people. And I also feel like I just have never really wanted to do the same thing every day in a row. I like doing different things. I feel like that really keeps things interesting. It helps a little bit with the potential of burnout because it's different every day. And in some different settings have different challenges and different benefits. And so it's kind of nice to be able to experience different challenges on different days. So I feel like I'm a good person to speak about these different business models and different ways that you can work within neurologic physical therapy. I do realize that these days it is a little bit harder to have multiple different part-time jobs because things like health insurance have gotten a lot more expensive in the past 10 years than they were 10 years ago when I started doing this. And my PPO great health insurance was like $82 a month. And I know that doesn't exist anymore. So that is one of the challenges. There is a need potentially to get benefits from somewhere. A lot of positions that you can get, though, you could have a part-time position that has benefits, and then you have some freedom with the other days of the week that you maybe do something different. So I do think that even though there are some realities that we have to deal with, there still is a lot of room for flexibility and discovering the things that you really love doing. But we do realize that there is some real world facts that exist in terms of student loan repayment and health insurance and retirement, all of that. And we definitely want to be realistic about what is possible and know that we also want to be saving for our retirement so that we can retire early at like 55 or something, or maybe not, maybe we'll work till 65. So I had multiple part-time jobs, and that has been really great, being able to learn and work in different settings and with different people. We will talk a little bit, actually next week I'll be talking about making that transition. So maybe now you do have a full-time job and you'd like to transition into having another type of position. Maybe it's a side gig, or maybe you go down to part-time to be able to pick up a different part-time job where you'll have a different experience. So there's lots of different ways to do that, and we will talk about that next week. So I won't get into that too much tonight. We want to keep our Facebook Lives nice and concise. Hey, Brian. So that they're watchable. So they're watchable now and they're watchable afterwards. I think Erin and I could both talk about these topics for 30 or more minutes, but we realized most people wouldn't have 30 minutes to watch it afterwards. So I made a couple notes about the different possible business models working as a Neuro PT. So for one, there is a spectrum from working as a physical therapist and doing more traditional physical therapy across the spectrum towards wellness. And so there are different ways that you can work with people. You can be insurance-based, cash-based. There are a lot of factors that are important to acknowledge here, though, such as the rules with Medicare in terms of charging clients cash-based, which is a whole separate topic that we can't get really in-depth in now. But if you are looking at doing cash-based and you serve people with Medicare, you definitely want to learn more about that and see what the possibilities are. For other insurances, if you work with a younger population or those who don't tend to have Medicare, then that's a little bit more free. Or more easy to kind of work around and do more of a cash-based model. A lot of times if you are working with a majority of people with Medicare, it may make sense to accept Medicare, but for others you'd be out of network or have more of a cash-based model. And just kind of figuring out, do you want to do traditional physical therapy, or do you want to do more of a wellness situation, or do you want to do some of both, in which case you just need to make sure that there's a very clear definition of what the differences are. And I won't go into that too much, but on Monday this week, Erin did a video about neuro wellness. And so she went into a lot of detail about kind of what are the requirements, who needs physical therapy, who needs wellness, what is the difference in terms of the definition for each, and how can you figure out what you are doing as a therapist, and are you working more as a physical therapist, doing traditional physical therapy or wellness. I've spent most of my career working as a traditional physical therapist and research studies and in the clinic. And then a few years ago, I started my program, Rogue Physical Therapy and Wellness, which really at the current moment is more on the wellness side. So we offer group exercise classes, some individual wellness and assessments, so that we can help people after physical therapy continue exercising and really maintain those benefits that they gained from physical therapy, if not hopefully continue to improve over time, which is actually what we see, which is pretty exciting because I do specialize with people who have Parkinson's, which is a neurodegenerative condition. So the fact that we can see over the course of 1 to 6 years that people are maintaining or doing better, that's pretty exciting, and that's really not what is expected. So I do feel like there is a huge gap in the healthcare system with regards to neuro wellness, of really helping people after or alongside physical therapy, staying active over time and continuing to get better. But kind of figuring out where you're going to be on that spectrum, because that has a lot to do with the whole insurance piece and how you're going to bill, etc. So you want to think about that. Then I would say a lot of the people I know who have started their own businesses did start seeing people in their homes. So the nice thing about this is you have very low overhead. So rather than going in and trying to find a space that you would rent and have a commitment to a certain financial amount, which out here where I live in California, space is very expensive. So that especially would be a hard thing to do to get started with right away. So a way that you can start working with people is seeing them in their homes. For one, this is a great place to see people because people with neurologic conditions often have challenges in their home. And so helping them be able to move around as well as possible in their home, helping them figure out some things, maybe rearrange some furniture and give themselves some space, help them really be able to do a sit to stand from every surface in their house that they would like to be able to, getting in and out of bed, getting up and down from the floor. There's so many places that you can help people be able to move better within their home. So I think it's a great place to work out. It's also a great learning experience to work with some people in their homes and see, the types of setups that people have. And I think that really helps you then, even if you're in more of an outpatient setting, be able to talk to people, really understand how their home is set up, what their challenges are. And if we're asking people to do a home exercise program, where is that going to happen? What equipment do they have access to? I do have quite a few people now who have a bike or maybe even a treadmill at home that hasn't been used in years. And maybe you need to go one time and see them in the home to help them remember how to use it safely, or, make sure that everything is still working correctly with it. So seeing people in their homes is a great way to get started. It is a lovely place to see people. And basically your overhead is your time and then some travel time. So depending on where you live, you may choose that there's going to be a certain range where you're willing to drive based on the amount of time. Or I know a couple of people who have sort of different zones. And so within a certain zone, they're willing to see people and it's a specific rate. And then if there's a zone where you're seeing someone further away from where you're starting from, there's an additional, say, travel fee. And for a lot of people, the convenience of having someone come to their home is extremely helpful. It means that they don't have to deal with transportation, which for people with neurologic conditions often can be a challenge, and they potentially need a ride, need to coordinate things. So having someone come to their home is extremely helpful. I have found it really increases, or let's say decreases, a no-show rate or cancellation rate, because you're going to their home. So there aren't things that can get in the way, like transportation. So in that case, your schedule can stay more full and you don't have those cancellations and no-shows that you're trying to work around. So seeing people in their home is great, and I highly recommend it. And I know many people who now have brick and mortar clinics and are working out of spaces that started in the home. And some people continue seeing people in their home because that's what works best for them, and they like kind of that setup. And then there's some people, like myself, I did start seeing people in their homes. And then over time, I found that because of the drive out here in California, I really had to give a lot of space in between visits. And I did have clients in a pretty big geographical range. And rather than choosing to just narrow that range and keep seeing people in their homes, I decided to start working out of a space and say, okay, you can come to me now, and that way I can see more people in a day rather than being able to see 4 to 5 people in a day. I can now see 6 to 8 people in a day, or as many people as I want to, given what I want my work schedule to be that day. So I have transitioned in that direction, but I know a lot of people who have continued seeing people in their homes and love kind of the freedom and flexibility that that provides, as opposed to making a commitment to a space. So seeing people in their home, renting space in a gym. So that's what I currently do. Working in a gym can be great because many gyms, especially like smaller gyms and even bigger gyms too, often can be busier in the morning before work and after work. And then during the day, they're not as busy. During the day, typically in normal business hours, is when we're more likely to be seeing our clients, depending on which population you work with. So a gym can be a great fit where you really can utilize that space and maximize usage of the space and work really well together. And in my current situation, I have access to much bigger space, more equipment than I would if I was getting space on my own. So it has worked out really well, and the scheduling aspect of it is great. I also, when I very first started, rented and worked out of a physical therapy clinic, and that was a little bit more challenging in terms of the schedule because physical therapists are there during the same business hours. They have kind of the same peak and busy hours as us, and I was trying to do some classes. If I had just been seeing individual clients, it probably would have worked in the physical therapy clinic. There was enough space if I was working with people one-on-one, but since I wanted to do some classes, that required using more of the space, so I really could only utilize the space when the physical therapist wasn't there, which luckily Tuesday, Thursday mornings, their physical therapy clinic was closed. They worked long days, Monday, Wednesday, Friday, so I had 2 mornings at least that I had access for classes, and then I was was able to do assessments and work with individuals at the other time and during lunchtime. And then eventually we actually both moved over to the gym. So within the gym setting that I'm working in, there also is a physical therapy practice with one PT and then myself, all utilizing that gym space. And it has worked out really well. And there's a potential for collaboration then too, since I'm more on the wellness spectrum. For some of my clients, when they do need individual physical therapy, there are multiple places that I can refer them to, one of which is the gym that, or the physical therapy clinic that's working out of that gym. So that's nice. People are familiar with the location. I have the ability to collaborate with that physical therapist and let them know, you know, kind of how things are going, give them my perspective, as well as I'm doing the evaluation, of course, for the patient. So there's some really great things about that setup as well. Let's see. And then eventually another business model is getting your own space. And that may be the place that some people start. They know we want to be in this setting, have people come to us. We want to know what we're able to do in that space. This is the model that works for us. And a lot of other people I know did start in the home and kind of have progressed over time, built up enough of a practice and decided, okay, I do want to work out of a space and get more of a brick and mortar and have people come to me. And I'm ready to make that commitment in terms of the cost of space, because then I'll really be able to do all the things that I want to do. And I know like Reactive recently opened 2 clinics, and I actually haven't been to the one up in West LA yet, but in Torrance, it is just a beautiful clinic. And I think when you have rented space or shared space for a period of time, when you do make that jump to getting your own space, it is so exciting, and I think you really appreciate all the things you get to do in terms of setting it up and scheduling things the way you want, that you really appreciate it in a way that you might not even if you initially do that on your own. So even though there are challenges with having your own space as well, some things you might have to deal with, there are really so many great things that you can do, and host courses and lectures and meetings with your clients, and so many things that you can do. So business model wise, we've covered kind of a few different things in terms of how you might be billing, if you're accepting insurance, if you're doing a mix of Medicare and cash-based for those who don't have Medicare, being out of network, fully cash-based, and working more on a wellness model. So I really think that working with patients with neurologic condition, there is just so much potential out there for all sorts of different ways that we can help people. We have also been discussing in our group, let's see, the potential to do kind of more of a rehab without walls. So can we help people and really help them reintegrate back into the community? So go on kind of field trips, go to the grocery store, go to, you know, maybe the locations that they want to go with their grandchildren, and kind of scope those places out and make sure they can handle the terrain and make sure they have the endurance for it. So there's so many potential things that we can do and ways that we can help people. If you do something, or if you're interested in doing something that I haven't mentioned here, please comment below, because we would love to hear about different ideas of what people are actually already doing out in the community, or what you're considering doing. And especially, you know, the more unique and different compared to what is available, the better. You definitely have to be creative working with people with neurologic conditions. We want to spend time with our clients. We want to work with them one-on-one. So in some cases, you know, physical therapy in many orthopedic settings can run a little bit more on a volume basis, where PTs are expected to see multiple people in an hour, and aides are there to assist with exercises and things. But this is something that's really challenging to do with people with neurologic conditions who are more complex and really require working with a therapist for the entire session, so that they really can get the most out of that session and make sure we're working on neuroplasticity and skills and progressing our exercises and fine-tuning every single thing we're doing. So it really is a different model than most outpatient orthopedic clinics. There are some that have more one-on-one and have a slightly different model there, but the majority of physical therapy clinics now have a little bit of a higher volume that's usually coming through on a day-to-day basis. So you do have to be creative when working with people with neurologic conditions, because how many people you see an hour, or how many people you see in a day, or how the volume coming through your practice total is going to have an effect on your revenue, of course. And so we need to make sure that these models are sustainable, both for covering the expenses we may have, whether that is space, and then also being able to pay ourselves and pay any employees, adequately. So there are some key things to figure out, and they are not simple or easy necessarily, but we really feel like it's worth it because the potential you have to impact people's lives is huge. And there are so many people out there who need our help. So we really want to be creative, come up with all these different types of business models, and try to implement those. So let me know if there's any other ways that you're doing things, or even if you are in a more traditional setting, working in a hospital or outpatient clinic, are there things that you're doing that are unique and special to help serve this population? We would love to hear about that. So please stay in touch with us. I'm getting close already. It's been 20 minutes. I don't know how that happened. It was like I blinked and it's been 20 minutes. So please stay in touch with us. Like I said, we have our Neuro Collaborative professional Facebook group. So that's a great place to discuss, ask questions, share information. Please join us in that group. We also have an email list. If you go to neurocollaborative.com, you can join our email list and we'll stay, keep you informed of anything, any new projects that we're working on. One project that we have going is something called the Neuro Tribe, which is a group, basically a power networking group where we've taken people who have been in our Facebook group and are interested for kind of the next level of access to information, sharing, meetings, groups, new research. There's lots of things that we're sharing in that group. And the Neuro Tribe, we will be opening and accepting new members at the end of this month. So if that's something that you're interested in, definitely let us know. We will be doing a few more Facebook Lives next week and the following week, and then we'll be opening up the group to accept more members. And so we're really looking forward to having more people in the group. We have about 30 so far, and it's been really fun. We have awesome people from all over the country who are doing really cool and different and unique things. And it's been a blast so far to spend time with people and learn. So I think that's all I wanted to cover. Please let us know in the comments if you have any questions or comments at all. We look forward to connecting with you, and have a great evening.